think we're here today to try and inform as many veterans as we can. We're here with Dr. Bash.
Welcome, Radio Land, TV Land, and YouTube viewers and listeners. This is Dr. Craig Bash. I've been doing veterans medical opinions for 30 years, and I have dozens and dozens of these radio shows which we're going to publish on this YouTube channel, and number 1 through whatever. So thank you for listening, and here we go.
I have 2 questions, actually, for Dr. Bass. One question is, I want to do a claim for diabetes because I was diagnosed with it after 1 year of leaving service, right?
Yes.
But I feel that I had the symptoms while serving. I had like elevated blood sugars, but not to the point where they would be diagnosed as diabetes, right? But I think I felt I had adverse effects as a result of being pre-diabetic, while serving, but just so happened, I didn't get diagnosed until, like I said, after the 1 year of leaving service. So, I've also been diagnosed with sleep apnea, so I don't know if there's a way that, there's a nexus there where that could, be linked to that, but I guess I just want to figure out how I can go about getting the diabetes, rated as service connected.
Right.
And then,
okay, yeah. Go ahead. Second question.
And then the second question is, on my separation physical, right? I claimed GERD, right, but was denied by the VA. But again, after 1 year of separation, I went in and had a scope completed, and sure enough, the doc pretty much said, "Yep, you have acid reflux. Acid reflux. Not so much GERD, but acid reflux." So I guess with that being said, I don't know if that could be secondary to something, or how would I go about claiming that as well, or. Yeah, so that's my 2 questions.
Yep. So GERD, you had symptoms of GERD in service, pretty much. You said you claimed it.
Yeah, my GERD. Yeah, my symptoms were in service, so I claimed it, and then they had me go to one of those, examinations with a private provider, and I guess they didn't feel that I had it. But it's ironic. When I went to the VA hospital, like I said, it was after a year, and sure enough, they ran that scope, and they was like, "Yep, you have it." So it's after a year, so I'm just trying to figure out how to go about doing it.
Yeah. You need nexus opinions. The first thing I'd say about the GERD, though, is make sure you get that checked up every year, because that GERD can turn into cancer. It can go to something called Barrett's esophagus, and that can turn into throat cancer, and that's very deadly. It only happens to about 5 or 10% of people, but you want to make sure it gets cleared up, because that's like a medical problem you got to make sure you keep on top of. So we see that a lot where you have symptoms in service, like for the GERD, and then you go outside for a QTC exam. The VA has strict rules on the QTC examiners, and oftentimes will deny it. But I could write a nexus letter about that, and what I would do is say that the GERD symptoms were present in service, and you had them continuously throughout. Afterwards, we'll do a lay letter about that, and I can use that scope and say the GERD was connected to service. There's some strict rules about that 1 year time period. Bill can talk about some of those rating rules, but the medical theory makes lots of sense to me. Now, the GERD can be a nice cause for your sleep apnea, and I do that a lot. I've got nice literature that talks about GERD causing sleep apnea, so I would do that probably as a secondary condition to the GERD and catch your sleep apnea that way.
I've already been diagnosed with sleep apnea, Dr. Bash.
Yep.
So I have a rating for that. I have I do the CPAP machine, and I have a rating.
Yep. And the same thing goes like for the diabetes. Now, your symptoms in the service, sometimes they have strict rules about what they'll allow, but for me, if your symptoms are there, I can write a nexus letter about diabetes starting in service and then continuing afterwards.
I'm curious. I'm curious. You say diagnosis of diabetes was more than 1 year after service, but just how long after service?
You say how long after service? Let me see. So I separated in Let's see, I had my exam in December 2014, so it was around about 2017, right? And the ironic part was for my retirement physical, I think I had high blood sugar levels then, so the examining physician, opted to say, well, hey, I'm gonna put you on this medication. I want you to come back for me to do your lab work for my retirement physical, and then once my blood sugars were within control, then of course he didn't write it up with the diabetes as well, which I found to be ironic.
Yeah. So you had presumptive diagnosis.
That's some great documentation. If we get our hands on it, that shows the elevated blood sugar and treatment for it.
Right.
Now, Dr. Bash can take a look at those values, what medication was used, and Dr. Bash, after he takes a look at those and sees what they were, could decide for us, could opine that represented the onset of diabetes. Now, diabetes is a disease of the endocrine system, and it's been deemed by VA as chronic disease. So if Dr. Bash finds that record that shows that test and the treatment and concludes that was diabetes, then subsequent manifestations, however remote from service, are by definition service-connected. And so that's something that can be won. Diabetes is very insidious. It's very slow developing. It didn't happen, in a year. It took time to manifest to the degree. First, there were some symptoms that brought you in for care, and you probably gave that doctor a history.
Well, no, actually, it was for my retirement because it was for my separation physical, right? They just, I guess the standard practice, they do lab work, right?
Yeah.
Yeah, that part. Sorry, I didn't mean to confuse you. That part, I understand. It was a separation physical when you had a test and some medication. Now, you said you were diagnosed several years after service, like 3 years, I think it was.
Yeah.
Now, when you went in and got that diagnosis, the doctor typically will ask you, well, what brings you here, and how long have you had this problem? And your answer could give us great insight as to when that began. And that's some very relevant and very important evidence. We get our hands on that, and that work that was done in service sounds like it could be a very strong case just based on this initial conversation.
What Bill's talking about is continuous symptoms. The symptoms you had during that gap period are very important. It shows you an ongoing process. Yeah. So in my mind, when I hear in my mind, when I hear that story about the treatment, that's like a presumptive diagnosis because that doctor made the decision in his mind that you had diabetes and starting to treat it right off the bat. So that's good. What caused the diabetes? Do you have it? Is there? Were you exposed to toxins, or was there anything that caused it?
Well, that's the thing. I don't know. I did serve in the first Gulf War, right? I don't know if there's any correlation there with their environmental concerns, but I noticed when upon returning from the Persian Gulf, back in 91 time frame, that my vitality and everything wasn't the same as prior to going over there, right? And case in point, I was going to say case in point was, like, even though, I'll give you an example, so like even I would train, like, just to be the, physically fit soldier that I can be, and it seemed like I don't care how much I train, I could never get to like a peak level of fitness because just the way my body felt, right?
Breathing?
Or, whatever was going on.
Was it breathing? You have problems with your lungs?
I'm sorry, say again?
Or did you have problems with your lungs? Breathing problems?
Yeah, it seemed like my lungs, muscles, all that, yeah.
Well, yeah, so there's a couple ways, like Bill said. One way is to do the continuous symptoms from service. Another way to think about it is to see if you're exposed to some toxins, which can cause diabetes straight out. And then the third thing you mentioned was maybe you might have some pulmonary disease, too, because a lot of soldiers were exposed to dust and aerosolized toxins, and they have lung disease, which decreases their vitality. So it might even be that you have a claim for lung disease to look at, too.
And I'm glad you brought up the lungs, Dr. Bash, because, like, I've, throughout my career, like, experienced wheezing, difficulty breathing. And they had me do the pulmonary function test as a part of my separation physical. And they said that the ranges were within normal ranges for me blowing into that tube. But people who serve, like, in Persian Gulf, they say there's another test that's more appropriate that
there's
DOD didn't administer to me.
Yeah, right. Yeah, there's a couple of special tests you can do. What happens, you breathe that stuff in, the lungs are like a filter, and it gets in the interstitium, which is like those little walls between the alveoli, and it gets plugged up and the air can't get across. So what you do is you do this test called a diffusion test, and they give you a gas to breathe, and they measure your blood and see how much gets across. And a lot of times that test will show some lung disease. Another test that I do sometimes is a thin slice, high resolution CT scan. And you can use that to try and look at the images and see if you can see some thickening of those little walls. So those are two specialized tests that, in a case like this, we might order and then see if we have some positive results and then try and help you get connected to that. So, yeah, it's good. Good questions.
Okay. Well, thank you. I definitely have to follow up with you after this session.
Yeah. Hey, Bill, do you have any more words on legal aspects of it or ratings aspects?
Yeah, that's certainly something we need to explore. And, of course, if it turns out that there is no explanation for the symptoms and it's a undiagnosed illness that's affecting you, that could possibly also be presumed to be service-connected. We spoke before about a multi-system undiagnosed disease that's presenting symptomatic limitations. That VA is empowered to grant presumptive service connection in Gulf War veterans. So that's something we'll need to explore.
Carl, do you understand what Bill just said?
Yeah, about the undiagnosed. I believe so.
Mm-hmm.
Yes.
Yes, it's like a joker card. So sometimes there's diseases that we don't know about even in medicine, and there's diseases that are in the war zone that we don't know about. So VA recognizes that these things are mystery diseases, and they'll give you credit for it.
Okay. So I do have one last question. So, like, let me ask you. So, based on what I've shared with you all today, like, what's your typical, like, rate or fees to like, I mean, just give me a ballpark. Like, what would it cost for me to get this addressed so that I can file?
Yeah. Well, I do my pricing kind of individual with each person, because if I say something on the radio, then everybody's going to say, hey, that's the price for everybody. So it all depends on how thick the record is and how much. We might have other medical opinions, and we might do more. We might have 6 claims by the time we're done instead of just 1 or 2. But you call me, we'll talk about it on the phone, and then we'll set up the price, and then we'll go after it.
Okay. All right. Well, I appreciate it. Yeah, I definitely will be giving you a call.
You want to go ahead and give him your number, Dr. Bash?
Yeah. A good way to get me is through my other guy that does my scheduling, Skip, and he's at 925-381-7561.
Okay, you
925
went fast. Yeah, 925.
Yep, 381-7561.
7561.
Yeah.
Okay, so 925-381-7561. Yep,
he's in California, so just call Skip up, and then he gets me the next day or two, and then we make a little 15 half-hour minute call. And it's good news for you now. The VA is processing claims pretty quickly. I had a guy last week that had his VA exam, and 5 days later he had his claim processed. So it's important for us to get the claims done up right at first, but they get processed quickly now.
Right. Okay.
Well, that sounds good. Thanks for calling in.
Well, thank you. I mean, so I guess if I just want to listen to the rest of the podcast, is that possible, or?
Oh, yeah, just stay right where you at.
Oh, okay.
Yeah, you might want to have another question pop up, but no.
Exactly.
Jump right in there.
Dr. Bash, my new phone-friendly website goes online tomorrow, so caller, you can check that out and find me that way too.
Okay.
Just Google Dr. Bash.
Yep.
Good.
Yep. Google Dr. Bash. Or Google Veterans Medical Opinion. You can Google that, and you'll get 53 million pages, and I show up on the first line or something like that. It's crazy. So we're going to talk about Bill. We're talking about DBQs maybe. So my normal package for the caller is like I do a nexus letter, number 1. Number 2, I do DBQs. Number 3, I'll do testing. And the caller just talked about some questions, and we had some testing. Number 4, we'll do like a lay letter. Number 5, we'll do like my resume. And number 6, we might do, add your medical information or other doctor opinions. So like 6 parts to it, might be 100 pages. You send them all in, 3 or 4 ways so that you can't lose them. But one of those big components is the DBQs. And so Bill could give us a history on DBQs a little bit. We can talk about how we use them on a daily basis. If you want.
Oh yeah, sure. That was some years ago they began, and I think one of the motivation was 2 parts. One, we had general requests in VA there where those of us on the rating board would want an examination. We would order an examination, and what we would get back sometimes would provide a lot of good data, but would leave very important, relevant findings off the exam and didn't answer specific questions we needed in order to select the proper evaluation. So VA established a committee and started developing these DBQ forms. And these forms were designed with the intent to solicit the specific findings the rater has to have in order to compare that to the rating schedule. And the second prong of that effort was to make these forms available to veterans so that they could have the form completed by a doctor of their choice, and it would solicit the relevant data from that doctor. And part of the reasoning was the more veterans who get their own doctor to complete the forms, the fewer comp exams we have to do, and it eases the burden on VA to have to schedule so many exams. I think another...
Let me intersect. These DBQs are really tricky. They can be 177 questions, and each one has a bunch of laws behind it. Bill talked about maybe the amputation part, but keep going, Bill. Sorry.
Yeah, some of them get pretty lengthy because there are so many questions posed as the courts review the rating schedule and the VA's decisions of the Board of Veterans Appeals, and they might come up with a need to remand the case from the court back to the board to say, well, look, you made this conclusion, but the examiner didn't answer that question. So by soliciting the question on the DBQ, that will reduce the number of cases that have to be remanded. And sometimes the court then will impose additional requirements that VA must address before evaluating the disability. Well, one of the problems is the need for VA to follow its own rules. And many times the court had to remand cases to simply say to VA, you're required to follow your own regulations. And so if you give an examination and your examination doesn't describe functional impairment on use or after repeated motion, then you have to get a new exam that describes that because your regulations say that's part of the evaluation. And so the VA would then add a criteria to discuss that. Another one happened again when there was a need to compare to the sound side and some other criteria that the court discussed in a case, it was called Kuea, and the VA then incorporated that into the examination form to prompt the doctor to answer those specific questions, things like on weight bearing and not on weight bearing by comparison. So this process evolves, and there's sort of a feedback loop between the field and the committee, going back and forth and constantly massaging these documents, generally increasing the number of questions on them. And sometimes Dr. Bash and I were just reviewing an interesting case. Sometimes what we get from the VA exam is incomplete. And it's incomplete because they didn't do the follow-up exam. And for example, since we were on the diabetes topic earlier, diabetes as it continues to develop, I think somebody's got an open mic going on here, doing dishes or something. Diabetes tends to progress over time. And as it does, it then starts to present complications, like some numbness and tingling in the toes, perhaps some cataracts. So we have these complications that arise as diabetes progresses. So the intent and what the manual provides is if you have a veteran with diabetes and you're going to try to evaluate it, you get the DBQ for diabetes. That examiner will identify all the complications that are present. Then each of those complications goes to a specialist in that area. For example, if it's causing a diabetic neuropathy, it goes for a neurology exam for the peripheral nerves. If it's starting to affect the renal system, it goes to a genitourinary examiner or an ophthalmologist for those complications of vision. So sometimes we'll get a basic exam, like in the case Dr. Bash and I recently reviewed, where the veteran has Parkinson's disease. Well, the Parkinson's disease is presenting a variety of complications, one of which is neurologic, obviously, and it's causing the patient to have tremors. But we don't have the follow-up neurology exam that will tell us which nerve distributions this disease is presenting. So we don't know if it's the median nerve, the lower radicular group, or all the radicular groups. Not to get too technical, but it makes a difference in the rating schedule. Which nerves are affected could carry a higher evaluation. We just simply don't have that neurology exam, so we don't know what the evaluation should be. In that case, we're going to be seeking some new exams.
So, this is Dr. Bash, but that's like what Bill's saying is those DBQs, they're complicated in themselves because the questions all have a lot of laws behind them. So the average doctor doesn't necessarily know the ramifications of that. And then also, the average doctor doesn't know that you can get layers and layers of DBQs like Bill was talking about, where one DBQ points to another and you have different systems that are involved. And also, the doctor can do the DBQs as a non-specialist, and that sort of forces the VA to do their own sets of DBQs with their own specialists, maybe, if they don't like it. So you can use the DBQs to your advantage in a lot of ways to try to understand how they're put together and the importance of them.
Yeah. Important tool, and it's important to use correctly.
Now, we have a lady that does some lay letter writing for us. Is Gail on there? I don't know if Gail's on there. Maybe not. Anyway, she's going to come on later on and talk to us a little bit about lay letters. It's another part of how they interface with DBQs and the nexus letter. So we had a lady last week that had upper, middle, and lower back. You want to talk about that one a little bit?
Oh, that's very interesting. Very interesting. My goodness, we have a noise here in the background. Yes, veteran had a skiing accident off a cliff. It was a very, very long fall. Appears to have lost some consciousness. Filed a claim and said lower, middle, and upper back. And they granted the lumbar. Okay? Well, now the question is, what about, she claimed 3 segments, lower, middle, and upper. Well, the spine, by definition, has 3 segments, lumbar and thoracic and cervical. So what about the other 2? The VA just left that unanswered. And so what we're trying to do now is to help VA understand that the original claim was for 3 segments of the spine, and by definition, that includes the thoracic and the cervical as well as the lumbar. And we're hoping to be able to persuade VA to take service connection back to the original data claim. It's a reasonable argument, and we hope VA gets a reasonable response. But there was, it's very interesting that Dr. Bash noted in her records there was bruising on the back at the level of the scapulae. And of course, Dr. Bash recognized that.
Thank you all for listening. That ends this show. And now I'm going to zoom off.